Hi, on Cracking Addiction today we discuss benzodiazepine withdrawal and the role of benzodiazepines in chronic pain and anxiety. So we're continuing our discussions on benzodiazepines and we're coming to the issue of tolerance. So clinical tolerance really means that you're starting to need more of the drug to achieve a previous level of effect or the same effect. And you can notice a tolerance to the soporific effect of benzodiazepines after 3 to 14 days of use. And you can get something called rebound insomnia after less than 10 days of use. And so what that means is that if you suddenly stop the benzodiazepine, you can find it more difficult to get to sleep. You can get tolerant to the anxiolytic effect of benzodiazepines within 4 months. So benzodiazepines can be used for anxiety. But if you're taking them for that duration, then you are effectively tolerant to it. And in fact, the Royal College of Psychiatrists in the UK state that benzodiazepines should be limited to no more than 1 month because the consequences of long-term usage are liable to outweigh the symptomatic relief of anxiety disorders. So effectively, you get to a point where using the benzodiazepine no longer treats the underlying anxiety disorder, but rather further benzodiazepine use merely treats benzodiazepine withdrawal, which looks very similar to anxiety. So what happens is that people take a benzodiazepine for a long time. They might stop it for 12 hours, 24 hours. They feel anxious. They take their benzodiazepine. The anxiety goes away. At that point, if you're using it for certainly more than 4 months, the anxiety is actually a manifestation of withdrawal. It is not simply that the pre-existing anxiety is rearing its ugly head. Once you're using benzodiazepines for more than 4 months, you have simply created a second condition on top of the original condition for which you had to use benzodiazepines in the first place. Closely related to the concept of tolerance is dependence. So dependence is predicated on an abstinence syndrome. So in the context of benzodiazepine dependence, we need to understand that this is all about the withdrawal symptoms that you get when you stop using the benzodiazepines. And you can start getting to that dependent state, as I've said, if you're using daily doses, even therapeutic daily doses of benzodiazepines for more than 4 months. 4 to 6 months is kind of the time frame at which I would start thinking that this patient in front of me is now dependent on it. Now, you can get dependent on benzodiazepines if you're using them at supratherapeutic doses much more rapidly. So it can take 4 to 6 months to get dependent on therapeutic dose benzodiazepines. You can cut that time frame down by 50%. You can get dependent on supratherapeutic doses of benzodiazepines within 2 to 3 months. We've talked about benzodiazepine withdrawal as being the hallmark of the abstinence syndrome, which then determines benzodiazepine dependence. So what are the symptoms of benzodiazepine withdrawal? So I use the mnemonic AMPS, A-M-P-S, I suppose, like electricity, amperes, AMPS. So A for anxiety, autonomic hyperarousal, and ataxia. And this is the key thing. The most important symptom of benzodiazepine withdrawal is actually anxiety, which is the same anxiety for which benzodiazepines are originally prescribed. Autonomic hyperarousal, well, by that I mean, raises in your blood pressure, your heart rate, your sweating, and you can have pupil dilatation. Ataxia, so you can start getting clumsy. You can get a tremor, so M for muscular symptoms, including tremor. P for perceptual abnormalities. So severe benzodiazepine withdrawal can actually cause perceptual abnormalities, visual hallucinations. And then S for seizures. So it's really important to understand that sudden cessation of benzodiazepines can cause seizures. It's unlikely, however, if you are on at least 50 milligrams of diazepam. Now, other authors, and in fact, the British Association of Psychopharmacology suggests that the minimum dose of benzodiazepines that you need to prevent a withdrawal seizure is actually the equivalent of diazepam 30 milligrams. But nonetheless, the incidence of benzodiazepine withdrawal seizures is actually very low. It's about 1%. And going back to the perceptual symptoms, so the AMPS, the P in that, perceptual symptoms are most indicative of neurophysiological withdrawal. And they can also include paresthesia. So by that I mean, pins and needles or feeling of something running along or tingling in your skin. Hyperacusis or tinnitus, so being very sensitive to noise or having ringing in the ears. And then something called micropsia. So you kind of get an altered visual perception and things actually appear smaller than you think they should be. So how quickly does benzodiazepine withdrawal happen after cessation of benzodiazepines? And the answer is that it depends. It depends on the half-life of the relevant benzodiazepine. So remember, half-life is the time it takes for the concentration of a substance in the body to reduce by half, and that's usually a fixed constant. The half-life determines the duration of action. So short-acting benzodiazepines with short half-lives include lorazepam, alprazolam, temazepam, and oxazepam. And you would expect to see the onset of a benzodiazepine withdrawal syndrome within 24 hours of cessation. This would peak at about 48 hours, but it can actually extend to 1 to 5 days. And really, you would expect the duration of this withdrawal syndrome to last no more than 7 to 21 days. Now, things get different when you're talking about benzodiazepines with a long half-life. So things like diazepam, chlordiazepoxide, and clonazepam. The timing of these benzodiazepine withdrawal syndromes is much longer. So you would expect the onset of symptoms potentially a week after discontinuation, and it would peak at about 1 to 9 days, and then it would last several days, in fact, up to 28 days. So the standard definition of the duration of a withdrawal syndrome from benzodiazepines, even in the case of long-acting benzodiazepines, is it's pretty much over by 28 days. However, in a later episode, we are going to discuss bind benzodiazepine-induced neurological dysfunction, and there we'll discuss how actually the withdrawal syndrome can last much longer. Now, I want to say a few words about the role of benzodiazepines in pain management. It's very common for benzodiazepines to be concomitantly prescribed with opioids because it's very common for anxiety disorders to coexist with chronic non-cancer pain. It's important to understand that actually benzodiazepines block the analgesic effect of morphine. And the use of benzodiazepines is associated with greater pain severity, greater pain interference in life, and lower self-efficacy. And it's been found that patients who suffer from chronic pain and who use benzodiazepines are more likely to be prescribed higher risk opioid doses. So we're talking about doses of opioids with an OMED, oral morphine equivalent dose of more than 200 milligrams. And they're more likely to be using antidepressants or antipsychotic medications. So we're seeing a picture now where benzodiazepines are really adding to the clinical risk of people who are experiencing chronic non-cancer pain and who are using high doses of opioids and also who are using antidepressants and antipsychotics. Now, if we look at anxiety, patients with chronic psychiatric disorders who are maintained on benzodiazepines for more than 3 to 6 months, in addition to their original psychiatric condition, whether or not it's adequately treated, are now also determined to be physically dependent on the benzodiazepine. So if you're on benzodiazepines for anxiety and you're taking them for more than 3 to 6 months, you've now got a second disorder. You've now got dependency on benzodiazepines. You've got benzodiazepine dependence. You've got, according to the DSM-5, you've now got benzodiazepine use disorder. This is particularly an issue for patients with panic disorder, and they're much more vulnerable to withdrawal from benzodiazepines as compared with patients who are using benzodiazepines and suffering from generalized anxiety disorder. And that's the second key point, is to understand that people with panic disorder are very sensitive to the effects of benzodiazepines and also sensitive to the effects of benzodiazepine withdrawal. The National Institute of Clinical Excellence states with regards to panic disorder that benzodiazepines are associated with a less good outcome in the long term and should not be prescribed for the treatment of individuals with panic disorder. The UK National Institute of Clinical Excellence is basically saying, do not use benzodiazepines for panic disorder. Do not use alprazolam for the management of panic in panic disorder. Do not use lorazepam for panic disorder. And speaking from a personal, professional point of view, I look after a number of people who are experiencing significant problems trying to come off alprazolam that was initiated for panic disorder or various other types of anxiety disorders. And they are experiencing significant challenges and significant distress because they're usually mismanaged. But again, we will discuss the management of benzodiazepine-induced neurological dysfunction in a later episode. So to summarize, we've talked about benzodiazepine withdrawal. We've discussed the role of benzodiazepines in pain management and in various anxiety disorders. That's all for today, folks. My name's Dr. Ferghal Armstrong, and this has been Cracking Addiction.